Hi, my name is Custer and I'm going to be your student nurse today. I'm from Western New Mexico University. So I'm going to provide the patient privacy. And could I please get your name and date of birth, please?
Adina Garcia, 7/27/2000.
Thank you. So today I'm going to be doing a cardiac assessment on you, listening to your heart rates and assessing your different pulses throughout your body. Is that okay with you?
Yes.
So I'm going to promote patient comfort by raising the head of the bed to 30 to 45 degrees, which he's already at. And so first I'm going to be assessing your neck and your carotid pulse. So first I'm going to ask you to turn away from me. So usually for checking the carotid pulse, you would lower the head of the bed and have the patient lay down. And in this position, you would inspect and palpate for the carotid pulse and for the jugular vein. And you would just be looking for any abnormal pulsations, which this patient does not have. So next I would be auscultating the patient's carotid pulse. And you're just checking this bilaterally. Could you please turn your head to make sure the pulses are evenly rhythm, that the pulses have an even rhythm and are synchronized, which they are. So then you would assess the patient's neck and upper chest to look for any bruising, any abnormal temperatures, any rashes, stuff like that. So then you would inspect and palpate the patient's chest and by looking at the different landmarks. So first I'm going to start out at the aortic valve in the second intercostal space on the right sternal border. Go across to the left sternal border and you're going to be checking in the second intercostal space for the pulmonic valve. Going down intercostal space is the third intercostal space for Erb's point. Another intercostal space down is the tricuspid valve. And along the midclavicular line in the fifth intercostal space is the mitral valve. So after assessing all this, you would listen to each landmark, and at the apex or the mitral valve, you would listen for 60 seconds to assess the patient's heart rate. And for each other landmark, it would be for 15 seconds. So again, starting at the aortic valve, right sternal border, second intercostal space, you listen for 15 seconds. Moving across the angle of Louis on the sternum, you would go to the second intercostal space along the left sternal border. And at the aortic valve, you would listen for S2 sounds, and the pulmonic valve also, as you're listening for S2 sounds. Going down along the sternal border, inching across the patient's body, you would go to the third intercostal space, listen to the Erb's point, which can be S1 and S2 sounds. Moving down along the left sternal border also is the fourth intercostal space, also known as the tricuspid valve, which you could hear S1 sounds. Going along the midclavicular line, could you move your breast tissue, please? To the fifth intercostal space would be the mitral valve. And here you would hear S1 sounds, and you could also listen for 60 seconds to get the patient's heart rate. So another way to assess the patient's heart rate is on a child could be to look on the brachial pulse, and for an adult it would be to look on the femoral pulse. So next I would be assessing her arms for any temperature, bruising, and checking capillary refill bilaterally. So everything looks normal. If you were to check the brachial pulse, it could be up here on the patient's arm. Thank you. And you would also check for the radial and ulnar pulses on the patient's wrist. Next, coming down and checking the patient's popliteal pulses, you would check bilaterally at the same time, assessing behind the knee again, and checking for any calf redness or tension. And once you're coming down to the feet, you would check the tibial pulses again bilaterally, and the dorsal pedialis pulses bilaterally. if the patient had any edema or deep vein thrombosis, you would be able to, they would experience some type of pain and would not do this next assessment. But otherwise, the patient would be able to express if there was any pain with that assessment. Yeah, I think that's it. Thank you so much.